This Good to Go segment is sponsored by Corewell Health.
October is Breast Cancer Awareness Month, an opportunity set aside each year to call attention to the latest in research and the importance of getting that annual mammogram to catch trouble early. Dr. Jennifer Johnston is here from Corewell Health and the Lemmen-Holton Cancer Pavilion to talk all things breast cancer. Hi, Dr. Johnston.
Hi, how are you?
I am well. Thank you for spending some time with us. What do we know about breast cancer as far as how many people have it, how common it is, and maybe who gets it, if we know that?
So it's an incredibly common breast cancer, unfortunately. We see it in about 1 in 8 women will develop breast cancer over their lifetime. So we're very careful to screen for that with the most robust methods that we have available to us.
Let's talk prevention first, though, shall we? Because
Sure.
that's obviously what we all prefer. Are there
Mhm.
things that people can do to avoid developing breast cancer?
Certainly, there are modifiable risk factors for breast cancer, maintaining a healthy weight, not drinking alcohol, or at least having modified consumption of alcohol, and overall just maintaining a very good health status. Um, there are other circumstances that are modifiable, like hormone replacement therapies or oral contraceptives. And that's something that an individual patient can talk to their provider about the risk benefit ratio of using those hormone therapies. And if that would be an adverse thing to do with their breast cancer health.
A lot has changed over the years, including the age at which women should have their first mammogram.
Mhm.
So, what's the current guidance on that, and how important is that mammogram?
So, the American College of Radiology and Society of Breast Imaging recommends annual screening to begin at the age of 40 years. And that is incredibly important for early detection. And detecting cancer can pop up in between year to year mammograms. So, the earlier that we can identify it, the more successful the treatment is, and the more minimally invasive the treatment is.
There are a couple of different versions or varieties, I guess, of the mammogram in
Mhm.
terms of how it looks at the breast, right?
Correct. So the traditional mammogram is the 2D mammogram, which is an X-ray image of the breast. And then newer technologies, we use a 3D mammogram, which is individual 1 millimeter slice thickness images through the breast, which increases the sensitivity and increases cancer detection. Throughout the Corewell system, all breast imaging, all breast mammography is 3D imaged. So you do not need to specifically request that when you come in for your mammogram. It's automatically performed because it's the best type of mammography study that we have available for early detection.
We always hear about self-exam and the importance of that and
Mhm,
knowing you're normal. Is all of
mhm.
that still a thing?
It is certainly important. You should be familiar with what your normal feels like because we can have normal lumps and bumps in our breast, and that's every individual has a different pattern and a different feel. So when you become comfortable with how your normal is, you'll be quicker to identify a change, and that can bring you into to have it evaluated. Mammography is such that we're hoping to catch cancers before you can feel them,
Mm.
before you know that there's a change. But there are cancers that are quite aggressive and can pop up in between mammogram to mammogram, so still incredibly important to do those self exams.
When
Mhm,
somebody receives this news of a breast cancer diagnosis, it can,
mhm.
obviously throw your life into a tailspin. Corewell Health grabs each person, walks them through the journey, even beyond treatment, right?
Yes, we have a fantastic support community within Corewell, wonderful nurse navigating team that is within the imaging department that helps that initial process of identification and diagnosis, biopsy, and then we'll connect you throughout our entire cancer health system within Corewell, which will provide emotional support, financial support, and then just ensure that you're getting the best care possible.
All right. We need to let folks know. For more information, call 855-SH-CANCER or visit spectrumhealth.org and search breast cancer. Thanks, Dr. Johnston.
Thank you.